Good afternoon and welcome to the April 14th meeting of the Department of Social Services Board. We welcome those in the audience as well as those who are viewing this meeting at home. I would like to call the meeting to order and observe a moment of silent prayer or silent meditation. Amen. And first item on the agenda is public comments, and today we have with us Julie Gill with the Teddy Bear Program to talk to us all.
Thank you for the chance to be here. My name is Julie Gill. I'm the director of the Teddy Bear Children's Advocacy Center here in Greenville. For those of you that aren't familiar with Children's Advocacy Centers, we join about 750 across the nation, providing child abuse evaluation, treatment, intervention, prevention when concerns arise for child abuse and neglect. Currently, we see about 800 children a year in different capacities, and we serve 29 counties. So even though we are located here across from the hospital, we have a very broad reach of who we serve. And our children come to us through referral from DSS and law enforcement primarily, and they return possibly for mental health treatment. And those referrals are by families or by DSS or law enforcement. And I'm here today because April is Child Abuse Prevention Month. And usually across the nation, we blanket communities with pinwheels, silver and blue pinwheels that are representing our hope and desire to help protect the innocence of children and let children have a healthy, safe, and supportive childhood so that they can grow into productive, strong, and healthy adults. We had a little issue this year across the nation with the dock workers strike in California. And so most of the communities are missing pinwheels this year. So that's an unfortunate thing, but we still want to promote this message and importance for all of us to work together. The child abuse programs are often challenged because it's no one single entity's problem. It's a healthcare problem, it's a criminal justice issue, it's a mental health issue, it becomes a substance abuse issue. There are so many components and systems involved that have to address when child abuse happens. And so our challenge sometimes is, where do we fit in government? Where do we fit in funding? Where do we fit? And the bottom line is we fit pretty much in many different capacities. So the health departments, medical schools here, Brody supports us and started the Teddy Bear Center over 20 years ago. Some communities' advocacy centers are funded primarily by United Way and local entities. But we have a unique role in the fact that we are medically housed as a clinic, and we have a very strong medical component. Because of that, we train residents, future doctors, nursing students, dental students, and then of course on the main campus we try to work with future social workers, future law enforcement officers, child advocates, child life specialists. So like I said, this is an interdisciplinary approach, and DSS particularly plays a huge role in the work we do. And we want to acknowledge and recognize that Pitt County DSS has been a very strong component of what we do. We are interagency, we are multidisciplinary, we do evidence-based work, and we try to make sure that those relationships with those that work with children who are at risk, and children who've been identified as abused, children who are in need of prevention services. We really appreciate all that Pitt County DSS can do and does in our relationship to work together, because it is a collaboration. And so we just wanted to say today, thank you for all that they do and that you do to allow them to participate with our work and to work really collaboratively in partnership. And this model is a challenging model in the fact that advocacy centers' real responsibility is to hope that we can have those alliances formally completed, and we just renewed our memorandum of agreement last month, and we are working to make sure that relationships are strong and collaborative and working together on the behalf to make sure kids are safe, healthy, and are able to grow and thrive. So, thank you.
And thank you for coming to see us today and for the work that you all and the other folks in Teddy Bear do. I know as a former social worker, Becky definitely has probably used your services and knows the services that you provide. The rest of us, I think, are all familiar with it. I know I have a son who's a med student, and I think he actually just did a 2-week rotation
Wonderful.
with the program. So you do work with a lot of different groups and spread the message, because I think the bigger the collaboration, the better off it is for the child in the long run and the family that's supporting that child. So,
I
anybody else?
remember when Teddy Bear, I think I remember when Teddy Bear originated here in Greenville. When was that?
We celebrated our 20th anniversary 2 years ago, so that's how I keep track of
Oh,
it.
good,
So.
so I do remember
But we
it.
did actually have interdisciplinary services before we were officially an advocacy center. And it was several physicians and, at the time, the district attorney, Joe Blick, and several others that really, Rosemary Haddock, several others.
Was Dr. Markello,
Yes, he was one of the providers. He was.
and where are y'all located
We're
now?
currently behind the Southern Bank,
okay.
right across the street of
Johns
from the
Hopkins.
hospital. Mhm.
Right.
Actually, we were at Johns Hopkins. Now we're in Executive Place, that little circle of brick buildings behind Southern Bank. So, and I think people are very surprised that we serve 29 counties. And that's unheard of in our world of advocacy centers. Most advocacy centers serve maybe 2 or 3 counties. And having county-based services, it can be very interesting to do that. So, and we're very excited. We're really working with counties in the east to have better representation. There are 30 CACs in North Carolina. Only 4 are east of 95. And we're hoping that changes. We helped Onslow start a CAC, and we're hoping to work with Halifax County, one of our poorest counties, but one that really needs that support. So,
Do you
but
have satellites?
we do not. We find that the challenge is resources in the community. And we require, when we see children, a collaborative evaluations. That includes the medical piece and the social work piece and the child advocacy piece. And so some of those medical providers are very hard to identify in those very rural areas. But we're working, and hopefully with the School of Medicine and future doctors that are working in rural health, that we're hoping to remedy. That's a national issue. We have a national shortage and those that evaluate child abuse. It's a tough job.
Invaluable, I tell you, it's
It
wonderful.
really is. Thank you. Thank you. Have a nice day.
Okay, thank you. The next item is to, are there any revisions to today's agenda? Okay, Mary has moved it.
Second.
Mr. James has seconded it. All those in favor, please say aye.
Aye.
Okay, and,
I move we approve the minutes as mailed if there are no corrections.
And I second.
okay, we have Mr. James and Becky on the approval of the minutes. All those in favor, please let it be known by saying aye.
Aye.
Okay, and then we have our consent item. We have 3 budget amendments. The Casey Family Programs Parent Partner Grant, $10,000, and then 2 GUC Neighbor to Neighbor funds for $10,000 each, for a total of 20. No county funds involved. Do we have a motion to accept these budget amendments?
Move approval.
Okay, so moved, and Mr. James will second. All those in favor, please let it be known by saying aye. And then the budget amendments are approved. Next, we have items for report. In-home services bid results.
Right, we have 4 bids for our in-home services for next year, and I will be opening those as we go here. The first bid is from Bayeda. And all of these bids, by the way, were received in the right time frame. Let's see if I can figure out the page that gives us the information we need. Bayeda Home Health Care proposes the following rates for service to Pitt County Department of Social Services. Level 2 personal care, $15.25 per hour, and level 3 personal care, $15.25 per hour. They are, we estimated 60 clients per month and approximately 8 hours of service per client per week, or 2,080 hours of service per month, and that equates to 24,960 per year. So Bayeda has said, using those figures, it would be an annual cost of $380,640 if we actually did all of those services.
What was that figure again, Jan?
The $380,640, and they are available 24 hours a day, 7 days a week.
Who's got the contract now?
I'm having a senior moment right this second.
Addis.
And Addis is no longer providing services in the next year, so they have withdrawn from the process. So there is the first one. The second one I have here is from Interim. I may have to cut it.
15.
Well, that didn't work. Taking the wrong books. Okay,
38,000.
and then it's still sealed. This is to make sure we did not cheat. Again, this is from Interim. They are proposing the above referenced services, which would be the level 1, level 2, and level 3 services at $13.50 an hour for fiscal year beginning July 1 and ending June 30. Their figures, they did not do the annual figure on here, so we'll just go with the $13.50 an hour. And they are available. Okay. The next one,
Did he give the total amount?
they did not do that, and I'm not doing the math in my head, I'm sorry. But it would be the same number of potential hours. The next is, let me see if I can get down here. From Health Pro Home Care Services. Trying to read to figure. If I'm reading this correctly, it looks like they are offering the bid at $3.1125 per 15-minute increment. And the number of units to be provided, 187,200.
Which is,
Let me read a little further and see.
that's $12.45 an hour.
That is the way they did their bid, was by 15-minute increment.
The first one.
15 and a quarter.
Okay.
So you said it comes out to $12 an hour?
$12.45.
And like I said, this is Health Pro Home Care.
And
Here's
is
the
this,
math in my
is this
head.
for 3 levels of care?
That's what I'm trying to see, if they make any differentiation between the levels, because this has all the contract information in it. That is, okay, here we go. Okay, it is $12.45. She
20
did her
years of
math
budget,
well.
I can do that math.
She did her math well. I'm looking now to see if I see any difference
You're whiz.
It's easy math.
in the, and they've broken it down the same way the first one did, with all the hours and all the, I don't see any breakdown with the different levels at all in here.
Is that
Doing a quick
required?
review. It would not be required as long as they're providing the same, you know,
That's right.
the
Oh, yeah.
cost
I
is
got
the
you.
same for each level. If they're gonna have different costs by level, then they'd have to break it down. So at this point, I'm not seeing anything. All right,
When we say by hour, is that, all the way through, straight through, but don't they have, is this the average hour, per hour that they pay, or does everybody, I'm sure, don't get the same pay?
that's how much they're gonna charge us
Oh, they're
per
gonna
hour.
charge us,
For us per hour, it is
Oh,
not what
not
they're.
what they're paying.
Right, no,
I got you, I'm
no.
sorry.
Okay, so that's that one. And the last is from Action Staffing. And let's see if I can get this one open without cutting everything. Okay. Action Staffing. $13.50 is their bid rate per hour for all the levels and the respite service categories. So those are the 4 bids that we have. Staff will go out and do a review of each of the bidders to get some understanding of what's going on, how they perform, that kind of thing. And we will bring back a recommendation at the next meeting for awarding the contract.
Did Action Staffing mention how much that totals for the year?
Like I say, some of the folks did and some didn't.
Because if you get them, you can answer interims too.
I
How
do
much is
not
budgeted,
see-
how much we have budget for this?
The budget is based on what we get from the in-home services grants, and that figure is not known yet. Okay? Well, as you know, Middy's Commission doesn't get those figures to the county until a little bit later, so that's where most of this comes
So
from.
we're gonna be able, we don't know how many we're gonna serve.
We don't know, we just based it on what we did this year,
I got
just
you.
to give them some sense. Okay? Okay.
Anything else on that?
I think that's everything we have for that.
Okay.
Anybody got any questions before we move on to
Staff
this?
will actually compare and make
Right.
sure that it's apples to apples and then bring a recommendation back
That's right.
next meeting.
Do the levels, does that signify the level of need?
It's,
Or,
it has to do with the type of care they need. The level 1 would be a less intensive type of care, and the higher levels would require more, more assistance would be needed for those folks.
but the employee, it looks like they're all getting the same amount per hour, so they all pretty much have the same training.
For this type of service, they would all be the same basic level in-home aid type position.
Thank you.
And this isn't what an employee
No.
is necessarily
Right.
gonna make. This is what the agency makes and then pays the employee some amount.
And I
Less
would
than
imagine
that.
that would be based on their skill and their experience.
so, too.
There will be some variance, I'm sure, based on that. And, you know, some folks may provide some level of benefits and some would not, so all that kind of stuff.
Like, can we serve all the people? Is it like childcare or?
Or is there a waiting list?
Right now, there is a waiting list for these
How does it
services.
stack up? So the best deal we can get, the more we can serve.
That would be,
Correct.
that would be
Okay,
true.
that's what I want to know.
That would be
How
true.
many people are currently on the waiting list?
And that's a question for Ms. Meekins.
Yeah, that's why I was
That's why
looking
we're
at Paula.
pointing.
You're looking at about 40 between respite and in-home right now,
And how many are actually served?
about 54.
So your waiting list is almost as big as your current caseload.
Are they all from Pitt County?
Yes, sir.
And there was a cut in those dollars mid-year this year, so we've in fact not been able to add anybody.
We try to keep the hours between 15 and 20 a week per client and 20 hours a month for respite services.
And you may need to come up if they have any more questions.
Any other questions that
I don't have it.
Paula can answer? Okay, then we will look forward to you all reviewing and making a recommendation. Energy update, Ms. Gwen Burns.
Well,
I think you've got a question.
Oh, I'm sorry,
I
Coral.
did have,
I'm
I did
sorry.
raise my hand. But I was looking at these 4 companies and the difference in the charges. And I was wondering, do any of them, is it because some of them have a longer period of time they've done this? Or is there are any of them on a quality basis, perhaps better evaluated or?
Well, when we go out and do the reviews of the different providers, we will be looking at a variety of things from have there been complaints? I mean, how their folks are trying, I mean, we'll be looking at a whole lot of different things. So in that situation, we would evaluate if there is a reason that one, we would want to go with a higher dollar provider. There'd have to be some justification in there.
Yeah. Thank you.
Now, Gwen.
The LEAP program has ended. That's the Low Income Energy Assistance Program, and this is our final report for 2014-2015. The program ended March 31st. We took no more applications after 5 o'clock on March 31st. We began the year with $1,097,372. We were able to approve 3,872 households, and the approved dollar value that we spent was $1,097,300, and there were 613 households denied. We had remaining funds of $72 because we cannot award anybody a benefit less than $200. So people were awarded $200, $300, or $400 based on their income and their household size. So that's why we have the $72 left over. And the total outpost applications, these were applications that were taken by our community partners that assisted us this year, were 615 applications. We did have a luncheon and debriefing with the community partners, and of the 10 taking applications, including ourselves, there were 8 partners that came to the luncheon and the debriefing. The luncheon was to thank them for their participation and helping us to disperse these funds to the community. And the debriefing was to look at what it is we did well, what we can do better next year, what were their needs as partners that we can provide to them next year so that they will continue to help us to take applications. Beginning in October, we will start again to advertise and recruit community partners and train them, those that want to assist us again next year, to be able to take applications again for us.
Sounds good. Any questions? Mr.
Yes,
James?
out of that 3,872, where are they located primarily? In other words, you have thousands of mobile homes in Pitt County. They're rural people, most of them, and most of them are more needed than a lot of the others because they're not organized. So I was kind of interested in how many, where they're located. Are they located in Greenville, Ayden, or in the rural areas?
They are located all
Well, I know they're
over.
everywhere, but you got a higher percentage, you know.
The higher percentage is in Greenville,
Yeah.
The
in
city.
terms of, in the city, in terms of
I'm sure there is.
applications taken. So,
That
but
surprises me.
the community partners were able to get applications from that rural community that you're talking about, Mr. James.
That's what concerns me because most of those are left out. They are not, a lot of them are in broken homes and so forth, in mobile homes, you know that as well as I, especially if you're in the school business. And, it would be interesting to kind of know where they are, who's using them, because churches are the ones that organize them in so many ways. That's how they are got it. So therefore, if that family's out there, they're not in a church or anything, and they might be as poor as a church mouse. I mean, have nothing. But yeah, they need some help.
Well, next year, what we can do, because we did not count the applications in terms of where they were coming from, whether they were like Farmville, Bethel, Ayden, Winterville. But next year, we can do that if that.
I guarantee you, if you'll check that churches, that some churches has got tremendous numbers of them. And there are others, the small rural ones, they might not even know anything about it, so to speak. Anyway, That's y'all's problem, that's not mine. But I'm really concerned to make sure we reach those people that really need it.
And we did talk with the community partners about themselves recruiting other community partners to help us to take applications out in the rural areas.
That's what you need.
And Ms. Perkins Williams did submit to me a person from Pactolus for next year that we will contact to take applications in that area. So we also have to be conscious of how many community partners are taking applications, because we have to determine eligibility and process those applications ourselves. And so we wouldn't want to be overwhelmed with applications that we couldn't process timely, because we have a time frame under which to process the applications. But this year worked very well.
Yeah. Do you work through the schools at all? Do you work within the school systems?
No, we
do
have
not.
not, no, we have not worked within the school system.
See, most
to
people
send
don't
out-
realize, in the Belleville area, you got 2 elementary schools, both of them are full. And then they got students from the Belleville area that go to Stokes, Bethel, a tremendous number. And people, the average person don't realize how many people are living out on the Old River Road and places like that in mobile homes, and they're not being reached in so many ways.
And one of the things, though, to remember is that we have a set amount of money.
I know that
And so
too.
if we have too many folks come in, then we're gonna have to turn folks away once we spend all that money. Not that we don't need to go out and recruit all the folks that we can get to give them the opportunity, but there is a set amount of money. And next year, we're supposed to probably be doing this with NC Fast.
Yeah.
It's supposed to be one of the next programs phased in.
Well, one of the ways you can help get the word out in the area, like Mr. James is talking about, is the animal services are now doing more community, our officers are walking and seeing people. They might notice a house that looks like it's got some issues and could share information about county services, because the move with the animal control officers, I serve on that board too, is to do more community relations and make sure that they see that the county can help them, like connect them with the pet food pantry or that sort of thing. And it may be that our officers would notice something out in the street, and it would be good for our officers to hear what services that, they could then tell somebody about if they saw somebody struggling, interdepartmental collaboration opportunities.
Certainly, that's something we could do for next year, too.
I know Greenville Utilities at one time became very heightened in interest with child abuse cases. And as much as they're out in the community, they could do kind of like the doggy stuff
Just,
as well. Just be
they
aware.
see some things, and they could sort of,
Is there a way you can get at statistics as to where your money was spent?
That's what Gwen was saying we could probably do next year. We did not,
But you can't, you don't
Divide-
have mechanisms from.
we don't have a way to search that now.
Right.
But we could do that for
because
next
you
year
paid
as we go.
That'd be a
you
good
paid the
idea.
benefit directly to a
Yeah,
utility.
the benefit
not-
went straight to the utility, that's right. So, yeah, you're right, sorry.
Anything else? NC Fast, Brian Averett.
For our NC Fast update related to
Somehow or
the,
another, that microphone
Yeah,
is
I'm not
not,
sure it's
can you
working.
hear
it's
me
not
now?
picking up. Or maybe it's just my sinus.
Okay. The NC Fast update report relative to our Medicaid program and work on our backlog project in applications and reviews. In March, the staff processed 963 Medicaid applications, while the staff took 510. So we're making progress on the pending applications. We have 1,020 applications pending compared to last month where we had 1,420 applications pending. We have 257 applications overdue as of now, whereas in February, we had 382 applications overdue. Reviews that are required to be completed by April 30th, 4,052. In the month of March, staff completed 3,341 reviews. This is significant. When we look back to January, staff completed 1,089. In February, 2,149 were completed. So we continue each month to increase the total number of reviews completed. And based on the track we're on right now, by the end of May, we would be within striking distance or within about 450 reviews if we don't increase the number in April that we process, within about 450 reviews of being complete as far as the total number of reviews that are backlogged. The state has decided to continue rolling forward any that are not completed in a month. So as has been done in the past, clients will still be able to receive uninterrupted benefits until we can get the backlog reviews completed. One thing we did in the month of March, toward the end of the month, as we were seeing or getting more reviews prepped than we were getting keyed, we then converted over and had the majority or all of the staff keying at the same time reviews that had already been prepped, and that worked well. So this is where we are as far as the applications and reviews are concerned. We're starting to see, as you can see with the applications, we have the new staff in the area, in the applications unit, are the skill level of that staff is increasing, and I think you can see that in the numbers of applications that are actually being processed. I'm very proud of the supervisors and the caseworkers for what they're doing, because you can see we're continuing to improve each month. And I'll be happy to answer any questions you have.
I would like to see, Art, you have March. Most people are smarter than I am, but I would like to see February there, March, so that I can compare those two together.
Okay.
You follow me?
Right. So when I give
I want to know the progress
Right.
that you are being made, and
Right.
since my mind is not so good, I want
Right.
to put it up there in black and white for me.
Okay, so maybe just do a comparison when we bring the
Right,
next report to
exactly
show where
right.
we've been, okay. So for March, they completed 3,341.
Yeah.
And in February, they completed 2,149. January, 1,089. So, you know, from January to February, we almost doubled the number. And then from February to March, about another 1,200 additional in March than we did in February.
Well, that's when I'm gonna be asking you why. See,
Okay,
I don't know why there's so many more.
Well, we've hired
You've
some
got more
additional
people. That's
staff.
a-
We've
that's a
had some
good
additional
answer then.
staff come in.
You got
and-
more personnel.
And the skill level, as we work with this, they're building up a higher efficiency in the number that they're able to
And
complete,
that's-
because as we go on, yes.
And I want to ask this, are we working closer with Pitt Community College to make sure that our personnel is up to par?
We are using in our hiring practice, that's just a piece of the hiring practice, when people have completed the career readiness certificate. And Pitt Community College did a profile of our specific positions and indicated what would be a good score for an individual to have the competency to be able to do the functions of the job. So that's one piece we're looking at. It's not required, but it does give an indicator of an applicant's skill level. And that we've seen that there is a good correlation between that and the person's ability to do the job.
We should look at it, make sure it is required. I mean, these people got to be able to do the job that we're hiring for.
That's correct.
So keep that in mind.
Well,
Okay.
right now, we have an issue with the state allowing us to require it.
That's where
So-
we need to hook up with, the
And-
state don't know everything
We have
sometimes.
shared that with the state staff so that they are taking a look at that as a possibility. But right now, they say we can only say preferred.
Okay.
I was wondering, have you reached a point yet where the employees that were being loaned from other departments are able to go back to their normal positions?
Well, now, we do still have 2 employees from the Register of Deeds office, and they are still with us because they're not having a high level of activity in that office, so they are still assisting us now. There are 2,
And how many did you start with that were loaned?
with just the 2.
Oh, okay.
Mary? Questions?
I was looking at the manager, maybe he's got others in other department that can be moved around. No, he's shaking his head.
And Brian, as much as Mr. James is saying something that shows month over month cumulative, improvement on a comparative basis, I still want to see something that's cumulative, that says we were this far behind, we added this many new ones, we've done this many today.
beginning to end,
This is now
okay.
where we are, so that I can see that, how far
Right.
behind we are,
Okay.
getting smaller each month.
Right, right. That's correct. Because based on my figures, and we can put together a report that shows this, if we do for April where we are for March, we would have about 1,767 that carry over from April to May, and then there are 2,023 from May already. That would give us a total of 3,790. If we did the exact same number we did in March, that would leave 449 that would carry over until June to be added to 2,143. So
in
for
You would
June,
start with a smaller beginning
correct,
balance.
correct. June, we would have 2,592, way below what we're able to
what you're
do at this
capable of
point.
doing
So
in a
we
month.
can put that on a report and show that, but that's the just a sort of
I
a
think
basic
that's sort
calculation
of, so we can
idea.
see the
Right.
dropping, then you really
Right.
do believe, oh my God, it's gonna happen in
Yes,
June.
and the staff, each day, the staff are getting an email that, like has been suggested, they can see each day how many are coming off the report. And,
Because I'm not so sure I can see you hitting the the 3,000 case in April, given through April 14th, we've only done 1,000.
maybe not, may
And I
not
know
be.
you had a holiday with Easter
Right,
and
we
spring
did.
break,
Bugs are working,
you know,
maybe the bugs are,
so,
losing legs.
but I want to
Okay.
know that
Right.
carryover amount is shrinking, so that, I think staff seeing that, it definitely
I think it's
helps.
definitely helped.
I mean, we started at 6,000, wasn't it, in February, and we started at 4,000. I mean, we've reduced the number each month that are carrying forward.
That's
If
good.
you had a
And this-
big chart
right.
of that, then
Right.
Right.
everybody in the agency
Right.
could see it.
And what is really cool, last month is we actually did the backlog plus some
Of the
of the
new.
current stuff.
Right.
So that's what's exciting to us. And in fact, some of Brian's folks have already started sending out the notices and the requests for information for upcoming months.
We're
So
ahead with that
We're actually
piece
working
now.
a little ahead
That's
in
right.
some respects.
That's
So that's a
correct.
good thing.
I've got a figure right here. For the December, meeting, there were 6,498 reviews due by January 31st, plus everything that's been added February, March, April since then. So we can put all that together.
I think if you had it in
Yeah.
one big picture, it tells your
Right.
story better.
I agree.
And it's, a lot of people are visual and they can see, wow, that really is improvement.
Brian, don't forget to let the staff know that we appreciate,
Absolutely.
We
praise
do.
them all that you
We
can.
have.
Most of the time, you get more results
Yes,
if you do that.
yes. Thank you.
Thank you, Brian. Next item for discussion is the director's evaluation. If you all will remember, back when we did our retreat in the fall, and then subsequent to that, we have gone and we have adopted a tool that we will use to do Jan's formal evaluation on. My recommendation as chair would be that we process the paperwork as necessary to grant Jan permanent status, which comes at 6 months. And now take this, and between now and our next meeting, let's do our evaluations of Jan so that we can do a formal evaluation of her prior to the end of the fiscal year. So if everybody could fill it out, then we could compile it, have it on our June agenda to talk about. But if by May, we could have our, everybody's input, then we can make a compiled report for Jan so that she's getting feedback moving into the new fiscal year and finishing up this fiscal year.
Now, you did a lot of talking.
I'm sorry.
What are you saying?
Okay,
Just do this for next month.
right.
Do we do it? Because we've been doing something and leaving it. Now you saying take this home and get it back?
Right, because this is on Jan
This is
Elliott
the annual.
specifically, right.
You're thinking about the evaluations we do of ourselves at the end of each meeting.
Yeah, so that we can give her a performance appraisal and let her know where you see a deficit or where you see cause for cheering, like great improvement in numbers. And then she's sort of got a path for where we want her to head, moving forward. You know, she's been doing a report to us each month to let us know what she's doing in the community, what her relationships,
I don't like these
Now,
comments.
that report about what you've been doing in the community and, okay. I don't even know.
I got a concern. I'm not good at commenting.
well, and if you don't have a comment, Mr. You're right.
Don't comment.
Don't comment. Mine would be easy to, that's okay. She knows I'm gonna let her know if I'm not satisfied.
But under the policy, she still needs an annual written evaluation, just like every other employee gets. The only way she knows what we want and where we stand as a board is if we come together. So my thought would be, everybody do their individual, based on where she's been doing her reports to us, relationship with the board, community relations, state agency relations, which are the sections in this tool. So you have your thoughts on it, and then we put all 5 sets together in May, and then share it with her after that, so that she knows sort of collectively where we stand.
Now, do we get one of these February and January as well?
You've had them in your packets each month.
Okay.
And unless
I'll
there's
go
a,
back and look for 'em.
Yeah, if not, let me know.
I would appreciate it.
but I mean, I think we can take the time in the next month to get our thoughts together, and then at the next meeting, we can put our thoughts together.
Let me ask a question. Should we, for that particular part of the meeting, include that in the closed session? I think that everybody would feel a little more comfortable in discussing concerns or issues.
Sure.
Okay.
I mean, it's a personnel issue.
Do what in the closed session?
Her
Her
evaluation.
Oh, yeah, that's a personnel issue.
Right. I came from a world where evaluations were done in open session, so it's hard for me to get past that. Not with Pitt County, but.
No,
you know,
never in Pitt County.
former- But no, I mean, we can put a closed session item on the May agenda if that's
Yeah.
everybody's. And it be to discuss our evaluation tool.
I wouldn't want my personnel discussed in television.
I don't-
Is this a time that I can express my appreciation for Jan taking time to meet with me a couple weeks ago? She's got it listed here, she should, because she just spent the whole, probably afternoon, going over with me about the different facets of the budgeting process and hiring, policies and any questions that came up. And one of the questions that I came in with was actually a request from my church's, their caring team, and that leader had asked that if we had some sort of a simpler guide for somebody that, just getting into, the application process, that we could share with members of our own church who need it. And she worked very hard on that, and I think she said she has given everybody a copy, which the first page is like just an overall checklist of things you might have to have assembled. And then she's included just a little bit more of an explanation for each of those areas that somebody might need, just to not to take some of the overwhelming, you know, the bulk of so much that you have to do. And I told her, you know, it might be a nice idea to have something like this on hand for just the social services, new applicants coming in,
Right.
just to give them an overall sense of, you know, maybe I can get all this information together. It's not as frightening as it seems.
Right.
And Jan spent not only time with me in her office, but she also spent time afterward, and she emailed me with a rough draft copy of this checklist and asked for any suggestions, and I just could not appreciate, you know, more. I don't think she could have done more than just a couple cartwheels or something to, you know, to try to make me satisfied. And at the same time, she made it possible for me to meet with Susan May, and I went to see her last week, and she spent as much time with me as Jan did, and just going over all that's involved and all that they have to think about when they hire new hires. And of course, to me, some of it was kind of frustrating, and she handles it very well. And I just appreciated the time that they took out of their busy schedules to meet with me, and that says a lot.
Oh, that's good to know, good to hear. So, yes,
Is this checklist new?
It is new in that it's been put together in one piece of paper. But it's the stuff that's always needed to be made available for people to have.
Out at the
At the Human
Operations
Service,
Center?
at the Human Services Center.
And they haven't had it before?
Well, when a person comes in to apply for assistance, they are given a checklist of the things that they specifically need for that particular program, okay? What I was trying to do was put together sort of a generic, these are the kinds of things you need to have, so that if you could bring it with you when you came, it might make things go faster, based on the request.
Yeah. And I'd like to thank, just if Gwen Gordon is listening, she's the one that actually came to me from the church committee to seek our help with that. And it was her instigation
That got
that
us to this
Jan
point.
responded to. And I really do, is there a way that we can use this or something like it, you know, put copies somewhere for somebody new coming in?
We'll be talking about that and seeing how we can utilize this or something similar to it. And we do have on there the web address for folks so that they can go get additional information and actually do the application online. So that is also on that document for folks.
Thank you.
so then are we agreed that we will go on our May agenda into a closed session item to do the evaluation? Susan, will you make sure that? Great. Next on our
You said
agenda,
this was on the website.
It's not on the website that way.
but the web information
But the
is on that
information's there.
form to get to the website. Director?
Well, the reason I was asking questions is that I've never seen a quick review like this. And it is good for the public.
Say, that's
And it's
very,
good for everybody to have.
that's very
And it's
handy.
good for everybody to know. And it's a policy that should be in place. That's what and when I was talking about policies, this is what I'm talking about. This kind of things that tell people what to do and what they can do and what to expect. And if it's on the website, you can easily draw it down and print it out. So that's what I was referring to.
And we can certainly put that on the website. The document that's attached to it is in fact on the website. Once you go into the application area and that kind of thing, you can actually get to that type of a
This is
document.
great,
But
good
that little
summary.
short checklist is not.
Just give you the overview real quick.
Yeah,
but I mean,
this
something
is
like
good
this
to
shared
have.
with the county
But,
commissioners
you
so
know,
they understand the
Here,
different
the
programs.
past, you couldn't get anything towards policy out of this department.
I think this telling what each program does and what the benefit looks like is very
We
helpful
can
to
certainly
have.
do that too.
Okay. Next item, if we're okay, is the director's report.
Okay. Child Abuse Prevention Month, we have for us, of course, that's a very important month. We are all about preventing abuse for children and responding to abuse and neglect reports. We do have for each of you at your desk, at your seat, a copy of the child abuse reporting statutes and information about that, not to make you experts by any means, but to give you information about what we do and how you go about doing that. Certainly, Julie has talked about the importance already of Child Abuse Prevention Month. I will say that we normally also do things like pinwheels and stuff, and you will see a few pinwheels at our entrances, but there are very few pinwheels right now. And obviously, staff have been very busy, and we probably this month are not doing as much as we have done sometimes in the past on Child Abuse Prevention Month. But do want you to be aware that this is going on. It's very important for us to remember every year, actually every day of every month, that children are abused and neglected in this county, and we need to do what we can to prevent that from happening or to respond as quickly as we can so that nothing worse happens. So that is why that is on your agenda. The next thing I have is the customer service survey. We've been talking about doing that for a while. I am passing out a Spanish version and an English version. So there's two pieces there.
If I went to Italy, they wouldn't give me anything but an Italian word.
Well, we try to get responses from everyone. These have just been completed. We have done a draft of it, and have the management team has had input on it. Supervisors have had some input on it. We're at the process, or at the point now that we're about ready to put them out in our lobbies again. They will be placed at the workers' desk. They will be in the lobbies. And there's going to be a box out there with signage so folks will know where to put these. We will send periodic reminders to staff to remind them to hand them out. So we're going to have them in a variety of places so that folks can pick one up. We have worked with our MIS department, and we believe we will be able to put this on our website so that folks could fill this out and send it to us if they chose to. And so we are working now to get this process started again. The county has done this in the past, so this isn't a brand new thing by any means. We're just re-implementing and made a few changes and that kind of thing. We're looking forward to getting the information, and then we'll need to do some type of report and figure out exactly how we want to use it. Certainly, if we see big issues around how we're dealing with folks, then we need to address those. If it's a specific worker that keeps getting mentioned, hopefully we can do an attaboy for them if they're doing great things, or if it's a problem, we can begin to address that problem. We are looking to get some good information from this. We have talked briefly about having a secret shopper come in, but we haven't quite figured that part of it out. So we're a little ways from the secret shopper thing. But did want this to be a starting point, and we will have this on colored paper so it'll stand out. And the staff, it was really cool that there was a suggestion in management team that the box have the colored paper on it some way so folks would also be able to see where to put it. So wanted y'all to have a copy. That was one of the things that was on my work plan. And
Is there a target for setting them, releasing them?
we're hoping to have this out in the buildings by the first of the month. It depends on how quickly we can get them printed, would be the only holdup.
Every department will have them.
We will have them in the Human Services building and over here in the county office building. So every section that we have will have them.
Do you have a statistic as to how many you're gonna distribute?
We will have a large quantity printed. We will know how many are printed.
That's what I'm talking about.
Okay, and then at that point, when we get them back, we haven't quite figured out all the process of how we're gonna manage this, because if we have them numbered, we're afraid folks are gonna think that means something.
What about a color code for the departments?
We have talked about that each building might have a different color, for example. So
Or
we're,
each department?
well, we could have one for intake and one for reviews, for
Yeah,
example,
that's
and
what
one
I'm
for
talking
child
about.
support.
That's
That's
what
what
I'm
you're
talking-
talking about?
Yes.
We were talking basically about the buildings, but you could do it for each department. it's going to be a little trickier
Because
in
if you
areas
don't get
like.
them back, yeah, excuse me for cutting you off,
Yeah.
but if you don't get them back, they're not gonna do you any good.
No, they won't do us any good
But
if we don't get it back.
isn't each department listed here?
They
so
are
could
listed.
just check beside the department that was served?
They are listed, they are listed.
So-
But we've got to figure out, we don't have any specific person who can be designated to work this kind of a thing. So the amount of information, can have some difficulties in us putting it together. But we need to have, we know how many we're printing, we know how many we're handing out, we know how many we're getting back. And we will know how many based on department or building, depending on which way it goes. And from that, we're gonna have to make some assumptions.
Have you spoken with maybe one of the departments at ECU?
We have not done that yet.
Social work or either statistical, the mathematics department, to talk about statistical and population, and populating
Right, right.
the thing. They
'Cause we're gonna
might
have to
have
make this
an
more
intern,
manual.
or they may help someone.
Yeah,
We have somebody looking to do a project
yeah, yeah.
with some
That
reporting
might be
and
pretty
Right,
good.
right,
What's
right.
this? This is April. Yeah.
Yeah.
You leave in May, so well, it might be just a thing.
Right, right. So we want to see, initially, we kind of want to see what we get back. And then from that, that will help us then know how we need to move forward with it. Initially, it's going to be kind of a test. And we do need to remind people periodically to give these out. I mean, we can sit them all over the building, but we want to remind staff to give them out. And so we'll have to remind them periodically to do that.
People coming in, like, ever receive like a packet of, paperwork that they're given to start with? Because I was saying, this could be one small thing in the packet.
Years ago, Brian may have to come help us with that, but some years ago, you did get huge packets of information. Now, so much of this is available online. We may not be giving folks as much information. But when people sit down at the desk and do that application with that worker, that's the time the worker can hand it to them.
Right.
About 50% of our applications now, though, are done over the internet or by mail. So that's why having it on the website is important. Clearly, we could mail this out when we mail back information to them for those who don't come in. There's a lot of work still to be done, but our hope is to get this out and started, and let's see what happens with it.
What about a special notation on the website?
We're working on getting things put out there as far as having this out there, and we can put a signage up on the website that says, make sure you do your evaluation, or we will make sure that this is seen. Susan's working with MIS to get that done.
And there's one thing I've been thinking about, that a lot of times, unless it's negative, positive news doesn't get seen, so there's gotta be a way to account for,
it's easier to get the complaints than the.
well, what percentage, if this,
Right.
You've got this many sheets out, apparently, you got 5 in, you got 100 that didn't come back, somebody must be happy, and it must be the other 95, or something.
Right, most of us usually fill out one of these surveys when we're not happy. And some of us will fill them out when we're really happy. But even the not happy people, that information can help us.
Right.
Even if that's all we get, that information can help us. But if you have any comments in the next few days about this, let us know if you need want any changes, because it's about to go to
Not ready
press.
to go to
The big press. We just had a short run, so we're about to go to the final press. So let Susan or I know if there's anything that's really bothering you about
Thank
it.
you.
Okay?
Agency personnel.
Right, okay. You can see from the report, let me get the report out.
Oh, this is an update, or?
That's an updated report. It's an updated report, hot off the press.
That's different.
You can see that on this, income maintenance is very busy. Brian has one that's in reference checking. We have one that's getting ready to be interviewed. And then the last 9 review positions are in the process of being screened also. They have closed out. So that will end the influx of folks from last year. We have a couple of folks that have left us for a variety of reasons. One was a retirement. Donna Causey retired. So that's where those positions are. If you look in services, we have 2 that have closed out already and either are interviewing or in the process of getting ready to interview. We have a 3rd one, the social worker 3, which is 694607, which will be recruited this week. It'll be posted when the county posts again, so that one's ready to be recruited for. And we have one in advertising. So things are moving along. We still have lots of folks to get on board.
I'm seeing the frozen comment, and it's in blue. Will those positions be unfrozen
Yes.
anytime?
Yes, and that's what this one that we're just getting ready to start recruiting for, it was being held. The county does like to sort of have a 30-day time period to make sure, after the person leaves, to give us time to evaluate the position, and then to also pay out any leaves or anything like that that might be hanging out there before we start the recruitment. And so that's why those are that way.
So this is like a hold rather than a froze.
Well, it's a hold, but I have to get the county manager's permission to recruit. So we put forward a recommendation as to why we need to recruit on this position, and then he looks at all the factors and makes a decision. Okay, the overtime situation, and I have this for you. Because you've been getting the overtime report for a while, I am only passing out overtime for the month of March, 2,845.5 hours. This March was the last month of paid overtime. The folks will get paid for this overtime shortly, probably sometime in the next few weeks. Starting in April, we are asking them to continue to do overtime, but with comp time only. And my ultimate goal, and Brian and I are working really hard to do this, is that April will be the last month of overtime.
Do they have to spend, use the comp time by then?
We are
See,
paying,
I'm looking at the bank.
we are paying them for this comp time.
Okay,
So, no,
okay.
they're getting paid for that.
But as we get new employees, which we have
We-
done, a lot of them, we should not have to have overtime.
The reason we're having overtime now, of course, is because we're trying to get the backlog done.
Yeah.
And as the
We want to do
backlog
that, of
works
course.
down, then that won't be necessary, which is why we're saying we're hoping this is the last month of overtime.
I would
The
hope
second
so.
issue is as the employees are getting more, we're getting more of the folks on, getting them trained, that also is working it down. So we are reasonably confident that overtime should not be a major issue in income maintenance anytime in the near future, once we get through this little phase. So,
Anything else you
I
want to share?
do have a couple of other things that you need to be aware of. We met with staff and talked about how we do internal recruitments. Internal recruitment. And when we did that, it generated, I think, some concerns from some of the staff based on the way it was framed out. And so I had to go back and make a few minor changes to it. But we went through the things that you're seeing in bulleted are items that we look at, because folks kept saying, how do you go about making decisions about internally who you're going to interview, who you're going to hire? Are you giving us a fair shake? And all that is pretty much what they were saying. So we wanted to make folks aware of all the things we look at. It's not any one item. It's the whole picture that we're looking at when we do a selection with folks. And so wanted you to be aware that this had been shared with staff. There have been a few questions. We've tried to modify it to clear up some of those questions, and hopefully we have done that. So, but that, it is not, it is not anything other than to give them an idea of what the process is, okay? So if anybody's got any questions about that, I'll be glad to answer that at any point. The other thing I have for you,
And I thank you for this sheet.
you're welcome. I have the evaluations from March for you to look at about the board, and I have the form for April for you to do. I have, one of the commissioners had requested some information, and I have responded to him, and I believe that I should share with you guys everything that I give the commissioners. The back of the document is the question that he asked, and the front of the document was the answer. So there should be one for everybody. Is that my copy? Okay. Okay. So not necessarily for discussion, just to be aware of. The other thing I wanted y'all to be aware of is that the Human Services Center has had the front entry replaced or painted. All that wallpaper came down in that front entry that was peeling. It's been painted. We're beginning to replace some of the chairs there that were so bad, in bad shape. So we're beginning to make some progress there, and I'm real pleased about that. Daycare is getting ready to have a change. Relatives who have had children, because they were assisting with child protective service, child welfare kinds of situations, the state has gone back and forth on that. And as of today, a letter is going out to 20 relatives who have children that we have been doing daycare without regard to income, to let them know that we're going to have to start counting their income by June. So just in case you hear from somebody, just be aware that that is out there and is going to be by June 30th or at their next recertification, whichever comes first. They have to start counting income.
I have a
Go ahead.
I have a question about that.
Mm-hmm.
That applied to emergency situations as well? For instance, with protective services, you take a child and you put him in the home with the grandparent.
Right, right. We still will, in those situations, for a period of time, provide daycare assistance without regard to income, okay?
Okay.
But that is not a forever kind of thing. And what the state has said back and forth and has finally decided on, that we are to evaluate those cases after a period of time to determine if there still is a need. And generally, after about 6 months, the thought is that we need to start paying attention to
How many investigators do we have now?
Child Protective Services investigators. That's a math question for me. Do you know off the top of your head, Ms. Dixon? 12. We have 12 investigators. Okay. That was everything I had. There was an incident at the Human Services Center this morning. Had to call law enforcement. Just wanted you to know in case you hear about that. Had a gentleman who had some mental health issues who had to be escorted out. So in case you hear about that. And that's all I have.
Next item in the package is the integrity reports. Unless someone has questions,
It's nothing.
there were overpayment investigations and,
Agency errors.
I was saying agency errors, and there were 8 food stamp cases, 8, 9, 10, 11 total food stamp cases, totaling just over $15,000. that are working to be recouped. Any questions? Otherwise, I would accept a motion to accept the report.
I so move.
I second.
I said,
Okay, now, question?
this is moving on to something different. I was
Okay.
afraid you were going to adjourn.
Oh, no, no, okay, so, all those in favor, please let me be saying aye. By saying aye. Okay, now, board member comments, Coral.
I wanted to be sure to express my appreciation for the wonderful luncheon that we were included in for the social services. And the speaker, Chris Carroll, couldn't have been more inspiring. And just the camaraderie of everyone there, it was just a lot of fun. And I appreciated also being able to be part of the listening session afterward. And I didn't want the meeting to go by before that being noted.
Well, I have a kudo, if I may, since we're kudoing. Sure. I think Angela Hart, having history with the department, I realize that at budget time, there is an extreme amount of responsibility placed on the finance officer. And not to take anything away from you, Jan, whatsoever, but I think Angela deserves a real kudo for her effort and good job at preparing and presenting the budget.
Anything, Mary? Mr. James?
I'm gonna make the motion to adjourn.
Not yet, not yet. I want to do one thing. I want to remind everybody that they received an invitation to the foster parents' dinner, and the RSVP is due by the 16th. So if you could let Susan know if you will be attending, so that they can prepare for the adequate number of head count. And also, can someone tell us what days in the budget meetings are, in case some of your board members want to come when you are presenting?
The budget date with Scott and staff is April the 24th at 10 o'clock. That's when we're meeting to
But
present
then,
our.
Scott, when are you bringing the full budget to the county commissioners? What week in May, do you know?
I don't either.
Can you just get those dates?
I will.
I think these folks need to be able to start putting that on. I mean, Mary will be at those meetings, but some of the rest of us may need to put that on our calendars if you need us there.
First week of May, the week of May 4th.
Okay.
Is that something we can get in our email or?
We can make sure.
Because they probably don't have the dates of the presentations set yet, but at least if you know it's that week, you can sort of keep it open. Anything else for the good of the cause? Go, Mr. James.
I move we adjourn.
I second.
So moved.
Let it come